Well, Dr. Liu, you mentioned about missing teeth and the fact that they can actually create quite some havoc. Mainly, you can lose many more other teeth, which isn't good, simply because teeth start shifting. You will lose, or eventually, you said, and then you said that you can lose gums, which make you looking, maybe giving you maybe a caved-in face, depends on how many teeth you lose. And you can even get tension headaches, shoulder pain, neck pain, simply because the mouth isn't quite aligned. When teeth are missing, the whole thing shifts a little bit, and it puts tension all over the place. Now, what are some of the main ways, the most modern ways, as well as, not the most modern? What are some of the one or two or three ways of how to replace a missing tooth these days, and what does it depend on? Tell us a little bit about that.
Yes, the ideal treatment to replace the missing teeth is what we call implants. And basically implants are a replacement for your teeth. But the biggest thing with implants that you need exceptionally well healthy bone in the area there. That's where the implants are placed, and even if you don't have good bone, there's ways that we can add bone so you can get an implant, but we would need to take further x-rays, and we would need to check with a lot of things around the area of the that you're missing the tooth. But that's the best way to replace a missing tooth. The second way
how does that implant more or less, in a big picture, how does that exactly work? What's the newest way? Because I'm sure that has changed over the last 20 years since implants are available. I'm sure it has nevertheless changed, maybe the material used and all that stuff.
Oh, that's right, Helmut. It's the implant itself. It's a very pretty straightforward procedure. Basically, we make a hole in your bone where the implant will fit, and then we would close up the gums over the implant and let the bone and the implant integrate for a few months, and then you put the crown on it. It's as easy as that, Helmut.
I see. And that implant, it was basically a metal screw which you put in, or what? A metal stick you put in the bone, and that's what's called the implant, and it sticks out, and that's where you put the crown on it then?
It's basically made of titanium, and it is a small little metal rod, shaped very small, and it's placed into the bone, into your bone.
And it grows, basically the bone grows around it, and so it's not cemented in it, it kind of grows. That metal stick is almost like naturally, like if you plant a tree, it's naturally sticking in there.
Yeah, the implant actually has grooves in it where it's actually screwed into the bone, and on the implant there's some they coat it with some bone chips, and that integrates with your bone.
Okay. All right. So it's totally naturally. That's why I guess it needs to be sitting for a few months to totally grow into it and become one or whatever.
That's correct. Yes.
Okay. All right. Good. So you were saying about the other method.
Yes. The second method you can use is I'm sure a lot of people are aware of it, is a bridge, and that's doing crowns on the teeth. Say you're missing a space, and you do a crown on one side in front of it, one side in the back, and they kind of connect, basically a bridge. And you'll say you're missing one tooth, then it's called a 3-unit bridge, 3 crowns in that area.
Okay. And so what are the advantages or the disadvantages of one or the other one?
Well, that's the reason why implants are ideal. If you take good care of it, it'll last you for your lifetime, basically. You treat it like a normal tooth. You have to clean it. You don't have to worry about changing it or replacing it. It's like your natural tooth. It'll replace it. That's the biggest advantage. For The disadvantage for the implant is basically it's a little more surgery, but it is a very straightforward surgery. And also, it takes a few months, like I mentioned, for the bone and the implant to integrate. So it's not right at that moment you'll get a replacement. You'll have to wait a few months. For the bridge, the advantage is, you'll get it within a few weeks to replace the missing tooth. The only disadvantage is you have to replace it every few years, and also it's a little harder to clean. You have to use special kind of floss to clean it, and it's easier to get cavities on some of those teeth.
So people who are a little bit, let's say, on the slappy or on the lazy side when it comes to flossing and to cleaning already, and then because it's more difficult, they have to use the thread floss, so they have to get it in. So it's more difficult. So then they might be here and there not doing it, and by doing so, they can create gum disease. That's what it is in that area. And then,
yes.
And then because of the gum disease, the whole bridge basically fails and has to be redone again.
That's correct, Helmut. If they don't clean it, they don't take care of it, gum disease will lead to bone disease, and then even the tooth might not be able to be replaced. You may have to actually pull out the tooth if it goes that far, but that's correct. The bridge will eventually have to be replaced.
Right. And you said that with an implant it takes a few months to put it on. So does the person have to, in the meantime, run around with a total empty big hole in it still, or does he can get some type of temporary which actually makes him aesthetically looking all right while he was waiting for the actual crown to be put on?
You know what, Helmut, it depends on the area. If they're missing a tooth in the back, usually, we're okay with them having the space there. But if it's in the front, we usually make them a temporary crown to fill that space, or something there to fill in that space so they don't go around with a missing tooth in the front.
Okay. So the waiting period isn't really all that bad, because in the meantime he does have a temporary tooth in it, right?
That's correct, yes.
Okay. All right. Okay, good. And any other reasons, any other things in terms of, like, when you do this crown, when you do this bridge, and you do this two teeth, and you put a cap or a crown on this tooth and on this one in order to hang the one in the middle, what about if those two teeth outside there are very, very good and healthy teeth? In order to put that crown on it, you have to grind those suckers down, don't you?
Unfortunately, that's right, Helmut. That's why the implants are the ideal treatment. For the crown, sometimes if that's the only option, you do have to take down healthy teeth in order to make a bridge.
All right. And you don't have to do that with an implant, because you just replace whatever is missing and you leave the good ones alone.
That's right. You don't need to touch any of the other teeth. All you need to do is in that space you make a hole in there and place the implant. That's all you need to do.
Right. So, and as you say that a crown on an average needs to be replaced much, much more often than an implant, that means it really turns out to be much more expensive in the end, doesn't it?
Yes, it does. In the short term, you're right. It's a little cheaper, but in the long term, it will end up costing you more to do the bridge.
Never mind the fact that you have to go to the dentist again, which none of us really likes, and the fact that you could be having gum disease more easy in that area, which in itself, as you mentioned in other videos, creates a whole host of problems, which we just simply don't want. Well, again, it was informative. Thank you very much for letting us know how, where, and what it is. I hope people out there will, understand the crown bridge and the whys and the why not a little bit better. Thank you very much.
Thank you so much.
Bye, Dr. Lu.